Hi. Has anyone here had balance screen done before? Anyone have a balance screen? I really enjoyed the pamphlet that Kendal put together for you. Balance is so critically important. A lot of times we don't suspect that we might have a balance issue, and the key is to address it early on, and that maintains your quality of life. So a lot of times you think, well, when I get up in the evening and try to go to the restroom in the middle of the night, I have a hard time getting to the bathroom if it's too dark. I have to turn on lights. I have to be very careful. That's a sign that you might need some training. When we do the balance assessment up here, this is a medical device. It is the type of system that's used in the hospitals, an outpatient rehabilitation therapy, and it'll give us a nice graph. And it actually will pinpoint what your area needs to be improved. And so even if you don't suspect that you have a balance problem, and more than likely you don't, but you'll have a nice green bars. That's what we like to see. See all the green bars. Now, if we have someone that might have some issues, we might see some red bars. And all that tells us is where we need to start the training. Because even though you have red bars, you can get to the green bars. And that's the key. And I think it's very helpful that you're starting today, because you can come in, I'll print you off your report, you'll have your balance screen. And then as time goes on, a year from now or something, you think, you know, I feel a little unsteady, maybe I should go back again. And so if you've got your beginning, you know where you are, and you'll know if you've changed. But more importantly for the therapist, when they look at this report, they know exactly where to start their training. So one of the key things why this system is accurate is because what I will do when someone comes up, obviously put in your name, so we have that on your report. We put in your height, and I actually line your feet up in a very specific way on the force plate. The reason for that is the system then knows where your center of gravity is, and it starts measuring. And what it's measuring is it's measuring your sway. Keep in mind, sway is natural. We all sway. We don't think about it. We really don't think about it. It's more obvious when we close our eyes, and then we feel like we're really swaying when we close our eyes. But that's still normal. And what the system will also do is we ask for your date of birth because we measure your balance against your age group. It wouldn't be fair to measure you or me against a 20-year-old. Their balance is going to be significantly different. So those are the key ingredients. So every time someone comes up, I'm going to line their feet up. And then the conditions are eyes open, just straight ahead and as still as possible for 10 seconds. Each trial is 10 seconds. The next trial is same thing, eyes closed. And what the system's doing is it's measuring your sway. You may feel like you're not even moving, but it detects your sway velocity. And then the last two conditions, I'm going to put you on this wonderful foam. And then you do the same two conditions on the foam. This is the most, how shall I put? It's the most amount of fun when you finally put yourself on 5 inches of foam. And how well can I stand? And what this does is it tells the therapist if you are trying to walk across gravel, if you're walking in sand, how well can you maintain your balance in those uneven conditions. And so we can't just test you on what's the most normal or the easiest, because you're not always in those types of environments. So that's really the key. And then we go through those, and then I can certainly print out a nice report. And then you can decide maybe a little bit of therapy. And you'll find that the therapy is very, very helpful. In the area, we have a lot of the hospitals in the area have a lot of our big systems. So if there's any fear of falling, we put everyone in a harness. And the big systems are even more sensitive. So when you move, when you sway, the floor sways with you, and the sides will move. And they really can totally identify what your issue might be and where exactly to start training. And usually 10 to 12 visits and training, and usually you're fine, depending on the situation and how well you adapt to the therapy. Are there any questions or?
Yeah, isn't it true that sometimes your balance is better than other times for whatever reason? Maybe you're tired or?
It can vary, but not that dramatically. It's not like blood pressure, we could be really high in the morning and then calm down. It's not like that. Your perception, your visual perception does change, like your blood pressure, but your balance does not. What will affect your balance may be medication. So that's one thing that the therapist should always ask when they're doing your screening, what type of medication are you on? Sometimes that affects your balance.
Yeah, you're talking about different areas of balance. Could you describe the different areas of balance that you're looking for?
Well, one thing I also, thank you for asking that, I have a little pamphlet here of information that talks about all the sensory systems that make up balance. Balance is quite sophisticated, very sophisticated. And so we use our vision, we use our somatosensory, or we're talking about our sense of feel, and we use our vestibular system. So if one of those systems is not operating properly, that's when we will have issues. And what this system does is it pinpoints if it's a visual, if it's a vestibular, or if it's a somatosensory issue that you might be having. Or it could be a combination of more than one. And that's when the therapists know how to start training. Because on each column here, we're testing something different. So when you're on a firm surface and your eyes are closed, we're testing your somatosensory because we've taken away your vision. Our vestibular system, which is our inner ear, only comes into play when you're doing gross motor skills, when you're moving dramatically. The small is not the vestibular system. So we're totally seeing how well your somatosensory, your sense of feel, how well that is operating. So then when we take away your vision, we see how visually dependent you might be. So for the different conditions, it helps us isolate where the area might be. And I do encourage you to take one of the pamphlets. It's a really nice explanation of all the different systems and how each one is very important. The one thing that I would like to stress, which is what was mentioned earlier this morning, I just attended a vestibular seminar at University of Pittsburgh Medical Center, and there was a couple research things that were done, and one of the biggest key things in the research was movement is key. When people stop moving, they see a quicker decline in muscle development, muscle tone, etc. And with balance, you want to catch that muscle tone and maintain. And that's how you maintain your balance. So if you have a little of a red bar, take care of it, and you'll have a better balance and better quality of life. So this is not something, this is preventative. The whole balance screen is preventative. We want to make sure that you have that, you maintain your quality of life. You want to be able to go out in your environment and enjoy yourself. Do I have any volunteers to start the balance? Okay, relax for a minute. We're now going to do the same two things, only I'm going to have you close your eyes. So let me, you ready?
When you're ready.
Okay, close your eyes. Open your eyes. You can do that one more time. So close your eyes. Open your eyes. Now I'm going to have you step off the force plate. And I'm going to ask for it to be a spotter, let's put it that way.
Beat the spotters.
Yes.
I'm probably going to be right in your way now.
And the easy way to do this now is to let me, as you stand in front over here, and if you want to hold her hand just for a second. Yeah, just hold on. And I want you to let me place your, as you lift this foot, let me just place it. Very good.
Okay.
And then try and place the other foot.
Let me see where it is. Okay. You want it in the same place?
Approximately. Let me take a quick look. Okay, move this side up just a little bit. There we go. Okay, how do you feel?
I don't know yet.
Okay.
Okay.
Now this is where we need to stay close.
Yes, that would be
Okay,
good.
and same thing, eyes at your
Okay.
side, stay as still as possible.
Are they laughing at me?
No.
No,
Okay, good.
but you can, I'm sure you think you're swaying more than you.
No, not too much.
Well, good.
actually.
Okay, relax for a minute. We'll do that one more time.
This is cool.
Okay, now relax.
Wait a minute.
Still. Be still.
Yeah, now I am.
Okay, relax a little bit now. Okay, and now the next one, the last one will be where we're going to have you close your eyes. So just give me a chance to get over there.
Let you fall. I
That would be
promise.
good. I'm not planning on falling, trust me.
Okay, we're going to have you close your eyes.
Okay.
And this seems the longest. It's only 10 seconds, but when you close your eyes on foam,
Yeah,
but you have to admit this is the most fun.
yes.
Okay, almost there. Almost. Open your eyes. But at this point, we were totally relying on your vestibular system when you close your eyes.
That's
okay,
cool. My
ready?
ears are good, I hope.
Let's go. One more. Close. Eyes are closed.
Whoa.
Focus. Okay, and you can safely step off.
Very good. Okay, how many red bars do I have?
I like that standing ovation you
One
get.
ham in every crowd.
Well, I give you credit for this group to come and do it first. Okay, here we go. All green. See?
Hey.
See? That's what we like to see.